Welcome back to Winging It Buffalo Style. Focusing on health now, we're taking a look at Cystic Fibrosis Awareness Month. This May, advocates are encouraging people to learn how this condition affects thousands of children and families right here in Western New York. It's a serious diagnosis, but our next guest does not let the severity of her situation bring her down. We are joined right now by Emily Beach, her daughter Marty, who has cystic fibrosis. We also have Brent McConnell and Eric Simon here from Respirotech. We'll introduce you and get to you in just a little bit. But Marty, it's so nice to have you and Emily, your mother, here today. And I can just tell that you guys must have a lot of fun together just based on your hair accessories.
Yeah, do we have fun? Yeah.
Tell us about your daughter, Marty. You know, we can talk about all the statistics we want about cystic fibrosis, but what is it like to be the parent of a child who's living with cystic fibrosis?
Well, really, Marty is just like any other little girl. She's 3.5 years old and very energetic and happy. But with cystic fibrosis, there is certain things that you need to be doing before she can eat or drink. She needs to be taking medications. She has issues with reflux and things. She does daily respiratory treatments that help to break up the thick secretions in her lungs and help her to clear mucus. We have to be extra cautious to make sure she doesn't get sick because even just for a common cold, she needs antibiotics and treatment.
And we're seeing a video right now. How many pills do you take every day, Marty? It's a lot. You're very brave for doing this.
Well, for her, she started with her medications and treatments when she was 14 days old. So to her, it is just normal. So she takes about 24 pills a day when she's healthy. She takes more than that when she's sick and needs antibiotics. But she's pretty much your normal 3-year-old. She doesn't think anything different for her. And a lot of CF kids and CF patients do need to go into the hospital, usually for a minimum of 2 weeks per year for treatment and medications, respiratory care, and that kind of thing.
And one thing that does make her feel better sometimes is a special vest that her zebra friend is modeling for us today. Erin and Brent, tell us about the zebra and about the vest that helps Marty with her condition.
Thanks for having us. Yeah, the vest is something we try to incorporate into the daily routine. We want to make it easy on the caregiver at home and also the patient. So we get to play a part in the treatment for the patient, just keeping the airways clear. We realize that's a significant part of the caretaking of the CF patient. And we try to set goals to make sure we can reduce pneumonias, maybe even some hospital visits and antibiotic and steroid use. So if we can accomplish that goal with what we have incorporated into vest therapy, you know, we're achieving something we're really proud of and glad to be a part of Marty's care.
So how does it work? How often does she wear the vest? How long does she keep it on for?
She does her treatment with the vest twice a day. It lasts for about 30 minutes. She does some other forms of airway clearance, including special coughs to help get the gunk out. She uses an inhaler when she uses the vest, and it actually shakes her. She kind of sounds like a munchkin.
She looks like a little munchkin.
Yeah. It shakes her while she's doing treatment, and to her, like, she just watches TV or plays on the iPad.
And Erin, these kinds of vests can help with not just CF, but other respiratory conditions as well.
That's true. We work with a lot of families with young children with cystic fibrosis, but we also work with a lot of the older population with diseases such as bronchiectasis. So I work with a whole range of patients to try and get them this therapy that really makes a difference for them.
And if people would like to make a difference in Marty's life, Emily, you have an opportunity coming up this weekend where people can do that.
Yes, we actually are having a benefit for Marty, which if you do any type of a search, whether it's Google or any other search engine, and you type in benefit and then the number 4 Marty, we have a video, which we showed briefly, but also we have a youcaring.com website where they can make online donations, and we are having the benefit at the Lancaster Elks Lodge this Saturday night from 7 to 11. We have beautiful handmade quilts, probably over 300 baskets, as well as over 20 big ticket items, 50-50, so that we can help raise money to cover the vest and her other medical needs and costs.
All right, well, thank you all for being here today, teaching us a little bit more about cystic fibrosis as we head into Cystic Fibrosis Awareness Month. And you stay brave, okay, Marty? Thanks for being here today.
Thank you.
Okay.